In this podcast episode, Dr. Stephanie Estima dives deep into the pervasive myths and challenges surrounding women's health, fitness, and dieting. Drawing from her extensive clinical experience and personal journey, she addresses misconceptions about body image, exercise, nutrition, hormones, and recovery. The conversation also reveals actionable strategies tailored specifically for women, aiming to build strength, improve body composition, and embrace a healthier relationship with their bodies. Dr. Estima opens by expressing frustration over society's fixation on weight as a measure of worth, arguing that women are often misled to prioritize becoming skinnier at the expense of their overall health. Having witnessed thousands of patients and her own struggles with disordered eating and body image, she emphasizes that the relentless pursuit of skinny can lead to detrimental outcomes like hormonal disruptions, osteoporosis, and mental anguish. Instead of focusing solely on losing weight, she encourages shifting attention towards gaining muscle, bone density, and connective tissue strength to build a body women feel confident and proud of. Several pervasive myths get debunked, starting with carbohydrates. Many women fear carbs will cause fat gain, yet Dr. Estima clarifies that carbohydrates are vital for mood regulation, sleep quality, and exercise performance. The outdated carbohydrate insulin obesity model lacks strong scientific backing, and overconsumption of any macronutrient, not carbs specifically, is the real issue. Another myth tackled is the fear of lifting heavy weights causing women to become bulky. She explains that because most women naturally have significantly lower testosterone levels, gaining excessive muscle mass is almost impossible. Initial feelings of bulkiness usually stem from muscle inflammation or swelling and subcutaneous fat layers, not actual muscle gain. Long fasts and intermittent fasting are also scrutinized. While fasting may support short-term weight loss, extended fasting risks hormonal imbalances, menstrual disruptions, and signals the body to conserve resources, which can be harmful, especially for women. Dr. Estima identifies 4 common archetypes to help women recognize their mindset and behaviors on their fitness journey. Overwhelmed Olivia is bombarded with conflicting social media advice, leading to inaction due to fear of failure. She suggests small, manageable goals, like increasing daily steps as a starting point to build confidence. The most common archetype is Skinny Fat Sophia, describing women who appear slim but have poor muscle mass, bone density, and overall body composition because they avoid heavy lifting and restrict calories excessively. When Sophia begins consuming more food and lifts heavier weights, the fat loss and muscle gains that follow feel like magic, shattering traditional dieting beliefs. Exercised Emily is someone who exercises intensely but undernourishes her body, not matching food intake to physical demands. This imbalance leads to fatigue and poor recovery. The ideal is the dialed-in Diana, who balances strength training, nutrition, recovery, and self-compassion to create a sustainable, joyful fitness lifestyle. The episode covers how hormonal fluctuations and the menstrual cycle impact exercise and nutrition strategies, particularly referencing conditions like PCOS, now known as polyendocrine metabolic ovarian syndrome. Dr. Estima notes that cortisol spikes during exercise are normal and essential for performance rather than harmful. Women with PCOS often struggle with insulin sensitivity, but can benefit greatly from resistance training and a mix of endurance and high-intensity interval training to improve glucose utilization and overall health. Dr. Estima advocates for 3 to 4 days per week of strength training, focusing on major muscle groups that contribute to a curvier, hourglass figure. The deltoids, bread buns, latissimus dorsi, angel wings, gluteus muscles, inner thigh adductors, and core pelvic floor. Women should aim for about 10 sets per muscle group weekly and train close to muscle failure to encourage strength and hypertrophy. She stresses that fundamental human movement patterns like squats, deadlifts, and presses are not male exercises, but rather essential movements everyone should practice. Due to anatomical differences, such as a wider female pelvis and a greater Q angle in the knees, women often need to adjust squat width and foot positioning to accommodate natural alignment and reduce injury risk. Strengthening the hip stabilizers, especially the gluteus medius, is critical to supporting the knee and mitigating injury risk like ACL tears. Cardio is valued for improving heart and lung capacity, VO2 max, endurance, and overall health span, not as punishment for food intake or just weight loss. Sprinting and plyometric exercises are recommended across the lifespan as they enhance mitochondrial efficiency, bone density, and fall prevention. Dr. Estima shares science supporting that older adults can significantly improve aerobic capacity and mitochondria function with sprint interval training, making age irrelevant as a reason to stop challenging the body. Women's pelvic floor anatomy and function differ substantially from men's, especially after childbirth. This hammock-like group of muscles supports pelvic organs and undergoes significant strain from pregnancy, hormones, and delivery. Kegel exercises help strengthen weak pelvic floors, but overly tight muscles require different approaches focused on relaxation. New mothers should seek guidance from healthcare providers before resuming heavy exercise and focus initially on rehabilitating pelvic floor strength and function before heavy load training. Dr. Estima highlights several evidence-based supplements beneficial for women's health. Magnesium glycinate helps with relaxation, muscle recovery, and sleep quality. Omega-3 fatty acids reduce inflammation and support cognition. Vitamin D3 with K2, at least 4,000 IU daily, is crucial for hormone production and overall health, even for sun-exposed individuals. Creatine, often considered a bro supplement, is highly effective for women to support strength gains, muscle fullness, cognitive function, and recovery, especially helpful during perimenopause. Collagen supplementation, despite some controversy, benefits joints, tendons, ligaments, and skin by providing essential amino acids needed for connective tissue repair. Electrolytes and vitamin C enhance hydration and antioxidant defense, particularly on heavy training or hot days. Protein from whole foods remains the primary source, while protein powders are convenient for travel or occasional supplementation. Sleep is the pinnacle of recovery, integral for growth hormone release, muscle repair, cognitive function, and emotional resilience. Although perimenopause can challenge sleep quality, prioritizing deep restorative sleep is paramount. Sauna use is a useful adjunct for recovery and lazy cardio, helping improve circulation and reduce inflammation. Proper electrolyte replacement after intense sweating aids recovery and supports physiological balance. Deceleration training and change of direction drills improve neuromuscular control, joint stability, and injury prevention, especially important with aging to avoid falls and maintain mobility. Simple body weight exercises such as side planks, challenging hip stability and core, squats, push-ups, glute bridges, and isometric holds can be done anywhere with no equipment. Sitting on the floor more often, a natural behavior in many traditional cultures, promotes joint mobility and functional strength, reducing fall risk. Dr. Estima emphasizes the importance of patience, grace, and a positive mindset in women's fitness journeys. Reframing failure, battling perfectionism, and tuning into personal goals rather than societal pressure are essential for sustainable progress and mental health. Muscle building and strength training became a path for her own self-love and healing, a message she shares for all women struggling with body image and worth. The conversation also includes candid discussion about female sexual health and pleasure, areas often overlooked or stigmatized. Painful sex related to musculoskeletal issues can be rehabilitated, and hormonal balance plays a big role in libido. Giving women permission to seek and enjoy fulfilling sex lives is part of holistic wellness. Hormone replacement therapy and GLP-1 medications may provide benefits, but never replace lifestyle efforts such as exercise, stress management, and recovery. Medications are tools to be combined with consistent health behaviors, not shortcuts. Dr. Estima stresses the value of scientifically grounded, nuanced, and personalized advice in a landscape flooded with contradictory social media trends and fad diets. Her book and podcast aim to clarify and empower women with actionable, evidence-based strategies that evolve with their bodies over time. She invites listeners to find balance, reject the pursuit of skinny at all costs, and embrace strength, vitality, and joy in their health journeys.